So I'm curious to know what you recommend to help manage some of those GI symptoms.
Oh, that's a great question. So the way that the GLP medications work and they cause the adverse effects is they're through different pathways they work. So one of the biggest problem that I see, we should look at it, what their effects are on our brain and what are their effects on our GI system.
Hmm.
The central nervous system, when these medicines work, they are areas in the brain, the different brainstem nuclei, they get stimulated by GLP, and that triggers uh, the sense of fullness,
Hmm.
satiation and fullness in our brain, and it suppresses our appetite, but it also activates nausea and the emesis pathway where we vomit or feel nauseated. And that is because the medicine, the peptides they're working on, and they happen to be in the same area where the appetite centers are, where satiation is happening, where fullness is happening. Those signal pathway, how they suppress our appetite, also trigger nausea. Now, the path which is people deal with mostly its direct effect on gastric emptying. So GLP medications, they slow gastric motility, meaning stomach is not moving down the food or crunching down the food as it used to be.
Hmm.
It's being slowed down. So that is because of the how these GLPs they affect through the vagal tone are in and neurons in our GI system and the smooth muscles of the GI system. And if during this, so the contractions is going down and the effect happens is that the food is not being digested enough. Now, the food is sitting in your stomach longer. You don't feel like eating again, but it can also trigger this delayed gastric emptying would give you nausea,
Hmm.
bloating, would give you sometimes feeling an acid reflux because those muscles or the sphincters that actually block that food to come back in your esophagus, they are not working as strongly. They've been relaxed, and that would lead to uh, acid reflux. Now, their effect on our intestines. So we have our brain, our stomach, and now our intestines. They are also not moving well. We become sluggish in our intestines because of the peptides, and the transit time where the food was supposed to travel down has now become slower and slower, and it causes constipation. And that relates to also a reason that people don't eat that much